Good afternoon, and welcome to this week's episode of Ask Dr. Murphy. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you today?
Doing very well, thank you.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, infectious disease, and public health questions each week here on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be answering a viewer-submitted question, addressing the latest headlines and our lone U.S. COVID statistic through today, June 27th. We invite you to submit any questions or comments down below or at any of our social media linked in the description. Starting with that U.S. COVID statistic, average COVID deaths per day in the last reported week were down to 26 daily. The same week in 2024, we saw 49 daily COVID deaths. Dr. Murphy, your reaction to those numbers and the general state of COVID here in the US?
Well, the number of deaths per day, 26, is down, and it's about half of what it was a year ago. So everything going in the right direction. We are at the nadir of this season's infection, and we do expect a pop-up in August. That's happened every other year. We don't understand why that's really happening, but we're at the bottom now, and all the wastewater reports and stuff are low. So, COVID is down. People are still getting it, all right, and it's still out there. The new strain NB1.8.1 now is up to 43%. It's taking over. This is the strain that is associated with more sore throats. So otherwise, it appears to be the same. So that's kind of the story. We'll see what happens, and if this is going to continue to go down every year. So from 2024 to 25, it's definitely down. So hopefully it'll keep going down, but I don't think it's going to go away.
That is good news. And some more good news is that there was a lot of research and surveys, data that came out from the Kaiser Family Foundation regarding older Americans and the efficacy of vaccines for them specifically. Can you tell us that data?
Age and wisdom. Older people are not giving up on the vaccines. It appears to be more of a younger person trend. But you think about it, seasonal flu annually sends 140,000 to 710,000, depending on how bad the epidemic is that year, to hospitals. Most of them are seniors, and it's fatal in up to 10% of hospitalized older adults. So they understand it, and they don't want to end up in the hospital, and so they take the vaccine. For older people, there's an enhanced flu vaccine, either a higher dose or higher antigen content. And if you use the enhanced vaccine, you have from 11 to 18% even better effect of the vaccine. So 65 and older, the enhanced vaccines are recommended. I think the dosage one is 4 times the regular dose. The antigen one's a little different, more difficult to calculate. Other vaccines that are out there, the respiratory syncytial virus is recommended for people 60 and over, is performing very well, very solid. Remember, it's the most common cause of hospitalization to infants and poses very significant risk to older people. The vaccines in the studies with 800,000 people, I mean, these are big studies. Vaccines appear to be 75% effective against acute infection, which is defined by somebody actually going to a healthcare provider in either their office, clinic, urgent care, or emergency department. The vaccines were 75% effective in preventing emergency room or urgent care visits, 75% effective against hospitalizations, and The side effects from some of these vaccines includes one serious one. It's usually not life-threatening, but it can be serious, called Guillain-Barré syndrome. It's a paralysis type thing that happens. It's usually self-limited and people get better. And they are reporting a low number that it happens just in the general population also, about 11 cases per million doses. So, that's 1 per 100,000, so it's pretty rare. And although the COVID vaccines are out there, they draw less support among adults. Still, 2/3 think it's safe and should be taken. So that's really good. The other good thing that happened in the vaccine field recently was that the shingles vaccine, the vaccine that prevents shingles from coming, the improved form Shingrix, in some very big studies showed that it also delayed the onset or prevented dementia from occurring. It was kind of unexpected finding. Just two big studies, one with 300,000 people and one with 104,000 in America, showed that it was very effective, up to 20% decrease. So just another good reason to take the Shingrix vaccine.
Absolutely. And before we move on from vaccines, we got a question from a longtime viewer. Thank you for watching and submitting your question. And they ask, they are 68 years old and they assume they received their measles vaccine when they were
Right.
young. However, they don't have those records. Do they need a booster shot?
This is probably the most common question I get right now, because of all the issues with measles going on and all the just many epidemics popping up everywhere. So if you were born before 1957, it's just assumed you had measles. Back then, there was no real vaccine record or card that people kept. Your pediatrician kept a record of it, but that was about it. And a lot of people, you don't remember, did I have measles or did I not have measles? It's just assumed you had it because it's so contagious. And, that was the baby boomer years. The schools were full. Every kid that went to any school or daycare or anything, everybody got measles. Now, if there's some concern, you can get an antibody test. It's inexpensive. It's readily available. Not a difficult thing. You just ask your doctor, you want a measles test to find out? You can get it. And then if for some reason you just think, I don't want the test, but I want to make sure I'm protected, I just want the vaccine, go get it. It's not going to hurt you. So you have a couple of options. So if you're born before 57, I think what I would do, and I was born before 57, just get an antibody test.
Like you said, that extra booster has been very well tolerated.
I didn't get one though, because I know I had measles. So I know I had measles and I had chickenpox and German measles and mumps. I had everything. And that was just the way it was back in the 50s. So 40s and 50s. So anyway, that's the story, but it's a very common question. It's a good question. And you can get it checked out or just take the vaccine.
For peace of mind if you'd like it. And while we're on the topic of measles, can you bring us up to date on all the new cases and the state of the current outbreak that we're experiencing?
Well, as of June 24th, there were 1,227 cases in the United States, mostly in Texas, although that's slowing down. Canada has 3,300 cases. There's cases really all over the place. Compare this to 2024, there were only 285 confirmed cases. So it's, 5x, 5 times greater. Overall, it's still 3 people have died, 2 kids and 1 adult, none of them vaccinated. And it's really pretty much all over the place. They're reporting it all over the world, Bolivia and other places. And just remember, those measles vaccine, if you take 2 doses of that, it's 97% effective.
Very effective and very important. So, if you haven't received your full schedule of the measles vaccine, that is the best way to protect yourself and those around you from being infected.
Mhm.
Now, some very sad news here in the US. There has been a listeria outbreak over the past few weeks and months. Can you tell us about it?
Yeah, remember last year it was boar's head meat. Um, they had a little problem in one of their processing plants, and there was a big outbreak. Well, there's another outbreak, and this is due to fresh realm chicken fettuccine Alfredo meals, which turn out to be very common. 17 people have been diagnosed with listeria. 16 of them ended up hospitalized, 3 of them died, and another one had a miscarriage after getting it. Um, and these are just the sickest ones getting diagnosed, so there's probably many more. And this chicken fettuccine Alfredo by Fresh Realm, there's a lot of it sold. So anyway, if you have one of those packages around, throw it away. Or take it back to the store and get a refund. Put it in a bag though. And it's just another outbreak. I mean, it's important we keep a handle on these food outbreaks because of the way food is, these pre-processed food is how it's prepared, how it's distributed, where it ends up. I mean, this stuff ends up all over the country, especially all the processed foods. So it's have to be careful. So keep that fettuccine thing in mind and avoid it for the time being.
Absolutely. Good to know. And unfortunately, another instance where there may be more cases than we're aware of, but following up in Cambodia from last week, the fifth case of avian flu led to the fifth death. Are there any more updates you can give us?
Yeah, it looks like there's actually 6 patients in Cambodia who've had avian flu, and 5 of them have died. So is this a high mortality rate, or are they just not diagnosing the lesser ill patients? We don't really know. But it's, again, another reason that we need to follow this if this is a higher mortality or not. It probably is. These people all were handling poultry, and they got avian flu and they died. Remember, we've called 174 million birds already because of this, and they're even thinking about giving poultry avian flu vaccine, but there's some pushback on farmers because they think that if that happens, American chicken meat will less likely be imported by people from outside the country. I guess that's a big business, and there's some concern about that. But anyway, they're thinking about that.
Something we will continue to keep our eye on both here in the US and abroad. But our final story today is a mix of a bunch of different topics, all related to funding cuts and the consequences of those funding cuts, as well as some additional funding coming in. Lots of exchange of dollars here, mostly in this case for global vaccines and HIV prevention. Can you tell us about it?
Yeah, US aid cuts had a huge blow affecting HIV prevention in Africa. The Department of Health and Human Services pulled US support for GAVI, which is the organization that is promoting vaccines worldwide, especially for children. Stepping in quickly was the Gates Foundation, who pledged 1.6 billion to bolster Gavi's childhood vaccine efforts, and Aging Biosecurity Labs pledges 1 billion for an upgrade. This is in the UK. But anyhow, this is the way this was done was really so unethical. I mean, it just abruptly stopped in many places. There was no wind down, replace it with somebody else. They just closed the doors. Very unfortunate. So there were, let's put it into perspective, in sub-Saharan Africa in 2023, there were 390,000 AIDS deaths. This is 62% of the global total and a 56% decrease from 2010. So, things were going in the right direction. And all this is just, it's just really sad. That's PEPFAR stuff. And then they are projecting that, this is not a vaccine, by the way, so this is treatment. And they're projecting, UNAIDS is projecting an additional 2,300 new cases per day. There were 3,500 new cases per day in 2023. And, we're trying to get that new infection rate below the death rate, and then the whole epidemic will actually burn out. And now it's going in the other direction. This is just very sad. And it really depends on the country. So the low-income countries, which is below approximately $4,000 per person per year, like Malawi, Zimbabwe, and Mozambique, almost entirely were dependent on PEPFAR funds. So they're in real trouble. The mid-income countries, which is like 4,000 to 12,000 a year, it's like South Africa and Kenya, their support from PEPFAR was only about 25%. So it'll be a little easier for them. But regardless, it's just so sad. GAVI itself, it's a GAVI, by the way, was launched in the year 2000. They have vaccinated more than 1.1 billion children in 78 countries and have prevented nearly 19 million deaths. This is vaccines now. Measles and pneumonia and other things. And the United States had been a major supporter, contributing more than $8 billion over the last 20 years. And it's just sad how it ended. As I said, Gates has stepped up to the plate, but doesn't fill the gap completely. To end on a little more positive note, the United Kingdom, through the Department of Environment, Food and Rural Affairs, or DEFRA, has pledged £1 billion, which I think is about $1.3 billion, to bolster a national biosecurity center, which will be looking for new diseases and ways to prevent future pandemics. So that's going in the right direction. That's a good thing.
Yeah, it's hopeful to see that there are large contributions. Other people are stepping up to the plate and trying to fill those gaps that we as a country are leaving. So
Yeah,
unfortunate.
There's other people supporting this. Even back to the Obama years, Obama took PEPFAR and made the countries buy in. They're not going to get all this stuff just for free from the United States forever. And getting other groups to buy in, PEPFAR was the beginning. This is, been the way it's been going, and it has been winding down a little bit. And yeah, it could have wound down a little faster. There's some good academic discussion that, maybe the United States is winding down too slowly. Regardless, you can't just stop it. This is just a very unethical crisis that is unnecessary. Give them, it would be 3 years or some time period where everybody knows they have to switch over. This is just, people are showing up at clinics, and clinics doors are closed. They're out of business, or they have no medicine to give them. It's just very sad.
Yeah, it's cutting down the options of, in some cases, people that have very few to no other options. So it's just a complete disaster.
I mean, we're talking people, with countries with less than $1,000 per year per person. This is poverty.
Yeah, it's an absolute travesty. And unfortunately, we will keep an eye as things continue to go downhill. Hopefully, these funding gaps that are being filled by other people can slow that down or help out. But it is very unfortunate. But I do want to thank you, Dr. Murphy, for your time and expertise helping us understand all these complex topics.
Thank you, Katie.
And thank you all for joining us for this week's episode of Ask Dr. Murphy. We hope to see you again next week. And as always, thank you for your questions and comments. If you have any more, please leave them down below or at any of our social medias linked in the description. We'll see you next week.